The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Josh Hubbard, and I'm an administrative officer for the Office of Mental Health and Substance Abuse Services. Thank you for joining us this afternoon for our February 2023 OMHSAS Stakeholder webinar. Starting us off today will be our new Deputy Secretary, Jen Smith, who's going to provide a few introductory words, and then we'll hand it over to Dr. Dale Adair for updates on the Behavioral Health Commission. Jen, please take us away.
Thanks, Josh. Good afternoon, everyone. So nice to meet some of you. Others of you I probably have had some interaction with maybe over the last few weeks since joining OMHSAS, or maybe interaction with you in my previous role at the Department of Drug and Alcohol Programs. Excuse me. I wanted to say a quick thank you to my staff. I had intended to do a significant portion of the talking today and found myself ill over the last couple of days, and they've been so kind as to pitch in and handle most of the talking for me today. But I will be on throughout the remainder of the call. I'll certainly be listening and checking your questions out as you type them in. But conserving my voice as much as possible. So look forward to future interactions with you, and thanks so much for taking your time to join us for some updates this afternoon. I'll start by kicking things over to Dr. Dale Adair, who's just going to give a brief update on the Behavioral Health Commission.
Thank you, Jen. Deputy Smith. The emphasis will be on brief, not because I don't wish that there was a lot to talk about in this space, but there really has not been any movement with the Behavioral Health Commission. This is an area, though, that we know that all of our stakeholders have interest in, and quite a number of individuals participated in the on the commission, and if not as members, certainly listening to all the testimony, and are well aware of the recommendations that were made. But to this point, there has not been any movement by the General Assembly, with the new administration and new legislators, and with budget hearings about to start. Do not know that we will hear anything. In fact, anticipate that we probably won't hear anything until after the budget hearing. So look for this to remain a agenda topic as we move forward. So we'll certainly share with you what we know in here. I'm going to move into crisis intervention services updates. First, regulation. So as I believe all of you are aware, there was quite a bit of time and effort in drafting crisis regulations last year. With the change in administration, there's a need to have those drafts reviewed by excuse me, current administration, and so the DHS is doing another look at them to make sure that they align, and that the secretary is in agreement with what went into the draft regulation before they then move on. So that process is underway, and they are currently being reviewed. So we'll also share further information as it becomes available. 988 legislation. Last year there was a lot of discussion about 988 legislation. In fact, we worked on drafting some legislation. As I believe most of you know, when the federal legislation was passed and signed into law, it created an opportunity for states to enact a telecom fee to help sustain growth and development of a crisis continuum. That has been a very difficult hill to climb for all states, quite honestly. There are only, I believe, 5 states which have enacted legislation to have a telecom fee as part of it. So, so we ended up not being able to move that forward. I will tell you, however, that there are several legislators who are expressing interest in revisiting the topic of legislation. Now, not specifically a fee, but of legislation. And I think that that is one of the things that we will be having further conversation about the best path forward with that. I can see maybe approaching things in a stepwise fashion, but those are conversations that we will be having. And in fact, we're in the process of setting up some meetings with some Senate staff to discuss further. So more to come. Excited about where this can potentially go, and we'll keep you all informed. With that, I am going to turn it over to Kendra Snuffer to start off talking about county funding opportunities for timely response collaboration. Kendra?
Thanks, Dr. Adair. Good afternoon, everyone. So I just have a quick couple items here. I did want to let folks know that recently OMHSAS released a county funding opportunity, which allows for county mental health administrators to apply for funding to essentially support collaboration and cooperation among all the different partners that it takes to create a well-functioning crisis services intervention system. So that could include obviously your crisis providers, your municipal and regional police departments, your 911 call centers, fire, EMS, and of course the 988 suicide and crisis lifeline centers. The counties can actually apply for up to $250,000 to facilitate this cross-agency crisis work, and it should be inclusive of law enforcement and lived experience advocates. And we just wanted to make sure that folks were aware of this. While the opportunity is, like I said, only open to county mental health administrators, a successful application and project requires the engagement of multiple kinds of stakeholders. So we would encourage everyone who is a part of that system to work with their counties to apply so that we can have the most successful possible outcomes of this investment. If folks have further questions about that opportunity, I will share the email address here in the chat in just a minute, so folks can have that at the ready. So the next item I just wanted to briefly talk about is the current bulletin that OMHSAS is working on around the 302 process. We have clearly heard the concerns that have been expressed from many of our stakeholders, and we thank you all for bringing your concerns and thoughts to our attention. It's critical that we hear from everyone when we're moving forward with creating these types of policies that impact our most vulnerable folks. So thank you for everybody who is chimed in thus far. We are working behind the scenes to not only update the bulletin, but also to create a FAQ document that will be the companion to the bulletin to hopefully answer some of the questions, provide some clarity around the conversations that have already been underway. So we just didn't want folks to think that had fallen off our radar. We are actively working on that as we speak. So, oh, hang on, I just see some questions here really quick from the counties regarding the county funding opportunity. While the application period did have the suggested date of closure of being, a week or so ago, we are still accepting applications for counties and partners who are interested. So feel free to continue to send those in. Dr. Adair, do you want to speak to us about the Columbia screening application?
Yes, I'd be happy to. Thank you. So this in particular really is speaking to the Columbia Suicide Severity Rating Scale, the CSSRS, which excuse me, is one of, if not the most accurate suicide screening tool available. Pennsylvania's been fortunate that there was an app for the CSSRS, which was developed, and it was developed here in PA. I'm not sure how many of you are aware of that, but shout out to Blair County. Jim Hudak and his group were involved and actually leaders in the development of the app with a app developer there in Blair County, but they worked with University of Columbia, specifically Dr. Kelly Posner, who is the lead scientist with the Columbia Suicide Screen to develop it. And I want to say it was developed in 2014, I think. With 988 launching in July of this year, we worked, so several of us within OMHSAS and other parts of DHS, as well as some of our external partners, worked with Blair County MH, with Kelly Posner and the folks at Columbia, as well as the developer, to update the app. And I believe that the update was pushed out this week, might have been a day or two ago, but wanted to make sure you all are aware of that. I anticipate that at some point the department, along with the partners who I already spoken about, who helped with the update, will most likely do a press release. But I will tell you, the app is used globally, so it was important to have it updated. In fact, Dr. Posner sent me an email, I think on Monday or Tuesday, since Monday was a holiday, that she had received a question via email, basically asking her when the app was going to be updated. So, that work has been done. We are working on some ways where, if an individual is willing to answer some additional questions, obviously they would have to opt in to answer these questions. We believe that the information will be helpful in helping inform what we know and what we see around suicide prevention, which can then help with further strategies for suicide prevention. So just wanted to make you all aware of that. And with that, I will turn it back to Kendra.
Thanks again, Dr. Adair. This next topic, once again, we have another funding opportunity that we wanted to make folks aware of. OMHSAS has actually released a funding opportunity for providers of behavioral health telehealth services. The goal is to support those who are eligible to apply with investments in telehealth technology and training. So things like purchasing equipment, HIPAA compliant platforms, and training on best practices of how to actually perform telehealth services. That opportunity is available online at our OMHSAS webpage, and I will put that link in the chat. Right now, it is open to providers with 50 or less staff across the entire organization, including any parent companies or subsidiaries. However, and I know one of the questions that we've received is, will it ever be available to providers with more than 50 staff across their entire entity? And the answer is, right now it's only open to 50 because the pot of money is finite. But as we see interest wane, if there's still funding left over, we will open that up to providers who are larger. I will say that along the same lines of telehealth, we also just wanted to make sure folks had the opportunity to tell us if there's anything that we are missing in the greater telehealth conversation. You know, as I was saying before around the 302 bulletin, we need to hear from you all on how we can best collaborate to support the access and modernization of providing behavioral health services via telehealth. So please continue to reach out to us and let us know if there's something out there that we're missing, that we need to update, that we need to change. We always look forward to getting your feedback. So let's see, our next, well, let me see if there's any questions on that first. Okay, so moving on, we just wanted to let folks know about an upcoming opportunity to participate in the Capacity Building Institute program. So what this training, and it's a multiple month training, does, it's designed to enhance quality home and community-based services and supports for people with IDDD and behavioral health needs by helping the professionals that serve those individuals gain the skills necessary to support them. Basically, it's an opportunity for folks who serve these populations to share and learn about best practices and supportive models that have shown to be the most helpful. It is a multiple month training, and the applications for interest for that opportunity will be coming out in May. That effort is a cross-office collaboration between both OMHSAS and the Office of Developmental Programs. So if that sounds like something folks would be interested in, please stay tuned for more information on that. And let me see, just checking the questions again, one moment before we move on. Okay, with that, Scott, you want to take us away for the system of care update?
Sure, it's actually a system of care and OMHSAS update related to training. And good afternoon, everybody. So OMHSAS, in collaboration with the PA Care Partnership, which is our system of care, has begun our 2023 speaker webinar series, which will go through this summer. We have had 4 webinars to date, and all of them can be viewed on the partnership's website, which I put in the chat at the very beginning of this meeting. The most recent webinar was yesterday for Black History Month. We had presenter Dr. Ilya Davis, a professor at Morehouse College, and the title of her webinar was Making One's Way in the World. Our next one is, will feature Dr. Noel Ramirez, who will speak on healing-centered practices and psychological flexibility for providers, community members, and healers, a case study of Asian American and Pacific Islander communities and mental health. This will be Thursday, March 9th from noon to 1:30, and you can find the registration on the same website that I posted. And lastly, in training, OMHSAS is collaborating with PA Care Partnership and the Office of Children and Youth to continue to provide opportunities for free trauma training that is being provided by Lakeside Global Institute. We've done a number of trainings to date, but there are opportunities that will continue through September and probably beyond for us to train groups at no cost. For more information for that, I put Aaliyah Carroll's email also in the chat. So feel free to, if you have any questions or if you're interested, email Aaliyah. Lastly, I've got a couple of questions about the RTF regs. So the update is that we are still going ahead with the RTF regs. They're still in the executive review process, having some new people like Jen and a new secretary. We want to make sure they get a nice look at it before we move it on. So our hope is to move on and have them promulgated during 2023. So that is my updates, unless there's any questions. And if not, I will pass it back to Andrew, I guess.
Thanks, Scott. I'm just looking through some questions here. So we did get a couple questions of asking us to share the link to the county funding opportunity around timely response. And I will say that because only mental health county mental health administrators are eligible to apply for that, those offices and those individuals were the only folks who received the application. And we encourage that anyone who is interested to reach out to their county mental health administrator's office to ask questions about what the status of the application may be, or if they've considered submitting. And Scott, someone has asked that you reshare those links. Perhaps Josh, you can, oh, it looks like Josh did maybe already share those. Thanks, Josh.
He's quick. I was just trying to do it.
Sure. Dr. Adair, can you share the name of the Columbia screening app again?
Sure, I'll spell it out. And if you, I have an Apple, but if you go to the App Store, and it's downloadable to Droids as well, but it's C-SSRS, so the Columbia Suicide Severity Rating Scale.
Thank you, Dr. Adair. I will share that in chat as well.
Thank you.
Just waiting here for another few minutes to see if we get any more questions that come in. I do see a general question here asking what kind of discussions OMHSAS has with some of our sister offices on our individuals with complex needs, or needs that certainly span just beyond behavioral health services. And I'll say that we have a lot of discussions and conversations with our sister offices. We have complex case teams where we have our subject matter experts within each office sit down together and talk about these sorts of individuals with multiple cross-cutting needs. So I don't want folks, just because I had mentioned ODP under the Capacity Building Institute opportunity, I didn't want folks to think that we're not also working with our other offices, OLTO, OCYF, OMAP, OIM. We're certainly engaged with all of them.
Yeah, and Kendra, on the children's side, also with the Department of Education.
Of course, yeah. Oh yes, yeah. I mean, DDAP, right? We have our our deputy secretary who came from DDAP. We work closely with DDAP, Department of Corrections, Department of Health, the Insurance Department. The list goes on and on. We're a very, very collaborative office. So I don't see. Let's see. Jason, are you on the line right now? Okay. Carlene, I just wanted to let you know, I do see your question, and we can follow up with you on regarding the reporting for COVID positive participants and staff. Another question that came in regarding the 302 bulletin, and Dr. Adair, maybe you can speak a little more to this, but there was a question asking what role have individuals with lived experience in their families, what role have those groups played in our discussions around the 302 bulletin?
So I can tell you, and Jenna was here, she could actually speak more to this, but those voices have been heard. I will also tell you, though, and this isn't particularly just to the 302 bulletin, but we are looking to change the process on how we do things like bulletins, but some other stuff as well. And that will, the entire process is not entirely worked out just yet, but it's close. But we're going to move towards a process where before we put out bulletins, that we will give, there will be an opportunity for anyone who is interested in a particular topic to be able to provide comments, concerns. So, we want to make sure that we are obtaining the input of those that are interested in whatever topic it is that we're working on, before we would actually end up putting some official bulletin out. So you'll end up hearing more about that. But it's an area that is very important. It's something that I know that the deputy as well as the secretary want to ensure that we approach all these things in a collaborative fashion, but to hear the voice and voices of those who these things affect. So that's all of our stakeholders. So, I just want to let you all know that. But in particular to the 302 bulletin, individuals with lived experience, their voices have been heard. No big surprise to anyone. Those voices do not always align with what the treating professionals think, feel, etc. So it's important to take everybody's input into consideration when we write our policies, procedures, et cetera. So thanks.
Kendra, this is Jason. I want to let you know I am on. For some reason, I could not unmute myself before.
Oh, sorry about that, Jason.
So I think I know what the question was, but can you read it to me so that I'm answering correctly?
Sure. The person who submitted the question is asking for any clarification on when a COVID positive participant or staff member, hang on, I lost the whole question because another one came in. I apologize. When is that reporting expected to end, if there is an expected end? And is there any updated guidance on healthcare providers wearing masks at work?
Great questions. So what I can say is the department has made a decision to continue reporting of COVID cases, and that's for individuals being served by our licensed providers as well as staff who work at the licensed programs through the end of the federal public health emergency, which at this time extends till May 11th. So the reporting will continue through the end of the federal public health emergency declaration. As far as whether or not things have changed, we continue to refer providers to both the Pennsylvania Department of Health website and the CDC website. So I will say nothing really has changed, but follow up on any guidance on both the Pennsylvania Department of Health or CDC websites. Thank you.
Jason, I was going to, when that last part of the question came up, I was going to respond, but you answered it very well. So there's nothing that I can add to what you said.
Excellent. Okay, well, we haven't had any additional questions come in here for a couple minutes, so I will give folks just a couple more seconds to submit any lingering questions that may be out there. All right, well, thank you everyone for joining us today. We always appreciate your participation, and as a friendly reminder, please, if you have suggestions for agenda topics or things you would like us to talk about at our next stakeholder meeting or subsequent meetings, please send them to that RA-OMHSAS correspond email that you can see on your screen right now, and we would be happy to add them to our agenda. All right, well, everyone have a great Friday and a wonderful weekend, and thank you all again.